Hi, I'm Dr. Adeniran, and today I'll be talking about high-risk pregnancies. High-risk pregnancies are pregnancies whereby there is risk to either the mother or the fetus beyond the normal obstetric patient. And what this literally means is that any pregnancy whereby by the virtue of anything, be it anything that has been in the previous history in the woman, I mean past events in the woman, or even the social life of the woman, or even the current pregnancy, is making the woman be at higher risk of having some morbidities or mortality, or even the fetus having adverse outcome that is more than usual of a normal obstetric patient, is said to be high-risk pregnancy. So what is the importance of identifying a high-risk pregnancy? It is important to identify high-risk pregnancies because these pregnancies are associated with high morbidity and mortality, meaning that the outcome of the pregnancy may not be our desire. Our desire is to have a delivery of healthy baby to a happy mother and of course a happy family. So in high-risk pregnancy, it is important to determine what is making the woman a high-risk pregnant woman, and subsequently prevent or even treat that condition in order to achieve our aim. So some of the social reasons why a woman may be carrying a high-risk pregnancy include the use of illicit drug. This may not be common in our environment, but it's something to really take note of. Consumption of high alcohol is something that is also very important, because all this may make the woman be at risk of things like bleeding before the onset of labor, or even a congenitally malformed baby, and of course we know some of the sequelae that may follow any of this. Other social conditions that may make a woman high-risk pregnant is a woman that is at risk of like a domestic violence. Because of this, the trauma, heat from here and there, may make the baby make the fetus be at high risk, or even the mother having an adverse outcome in this pregnancy. So other past history, like in previous pregnancy, that may reflect in this present pregnancy include a woman that's had a cesarean delivery in the past, a woman that's had elevated blood pressure in the past can also be a problem in this pregnancy, or even delivery before the age of our so-called 9 months, which is about 37 weeks and above, may reduce the prognosis, may worsen the prognosis of both the mother and the baby in pregnancy. Other high-risk condition, especially in our environment, is a common thing that we know, which is sickle cell disease. A sickle cell disease patient is at risk, is a very high-risk patient in pregnancy. So because of this, it is important to identify and appropriately monitor this patient during pregnancy, labor, and days after delivery in order to have a good outcome. Other things that may make a woman high-risk pregnancy include a woman that has like multiple births. She has had multiple births in the past. The uterus can be, or the womb can be can be described in form of a balloon. Each time you go through labor or delivery, you blow the balloon and deflate it, and you know that means it cannot go back to its original size and even thickness. So because of this, previous multiple delivery may make a woman to be at high risk. So what do we do when we are able to identify some high risk? If you know that a particular medical condition like hypertension, diabetes can make you be at risk of having bad outcome, or you have had a bad outcome in the past from any of your previous pregnancies, it is important to preferably even go to the hospital before you have another pregnancy, because it may be important to pick some conditions even before the conception, before pregnancy, control these conditions like the illicit drug use that we talked about, or alcohol. You may need to stop some drugs, some habits even before getting pregnant in order to have very good outcome, and this is called like a preconceptional care. In our subsequent videos, we'll be discussing some of these topics better. So now, other thing is, whenever you miss your period, a positive pregnancy test is important to present in the hospital, and with adequate counseling and monitoring, you can prevent complications that may arise as a result of high-risk pregnancy when they are picked on time. And also, such patients should not just register for their antenatal care in any health center. It has to be like an obstetrician monitored antenatal care, whereby we have the professionals, midwives are there. There is a good neonatology care can be guaranteed in case there is need for any of these specialty. And of course, during labor, such women should not just labor in any hospital. As we have said, some of them may need surgical intervention for the delivery of their babies. So that means it is important, it is paramount, it is germane to register such pregnancies in places where they can be offered optimal basic obstetric care. So by and large, we have been able to talk about what high-risk pregnancy is and some of the conditions that are examples of high-risk pregnancy. And briefly, we have also talked about what can be done in order to reduce the morbidity and mortality both to the mother and the fetus in high-risk cases. So we hope that you have enjoyed this video, and want to employ you to like, share, and even subscribe to our channel in order to benefit from more from our educational sections in subsequent video. Thank you for joining us.